You know, if you spend like more than 5 minutes scrolling through social media these days, you are practically guaranteed to see someone raving about a so-called miracle facial.
Oh, absolutely. It's everywhere.
Right. Like they are pointing to their glowing skin, throwing around all these buzzwords like salmon DNA or exosomes, and they're claiming they got these flawless face filter results literally overnight.
Yeah, and the before and after photos, I mean, they're engineered to look flawlessly instantaneous. They completely sell this illusion that you can just erase a decade of cellular aging while you sleep.
Exactly. It sets up this wild expectation of instant transformation. But, you know, when you take that same trending science, those exact same microscopic biological messengers, and you move them, well, below the belt, the conversation changes entirely.
Radically, yes.
So today, for you, the learner listening right now, we are taking this science away from the glowing ring lights and into a highly requested, deeply personal territory. We're talking about intimate exosome therapy.
Which is a profound pivot, really, because when we examine intimate health, we are dealing with complex functional tissues. We're talking vascular networks, nerve endings, not just surface aesthetics.
Right.
The biological stakes are fundamentally different.
They really are.
Yeah.
So whether you are dealing with age-related changes, maybe postpartum recovery, or you're just, you know, insanely curious about where regenerative medicine is heading, we have a very clear mission today. We are going to cut straight through that social media hype to answer the ultimate question. How long do the results of intimate exosome treatments actually last?
It's the most important question.
Okay, let's unpack this because we have a massive stack of sources today. We are analyzing clinical trial data on erectile dysfunction. We've got animal models studying menopausal vaginal atrophy, and even incredibly strict regulatory warnings from both the UK and the FDA.
Which, honestly, are entirely necessary considering the sheer velocity at which this field is expanding right now.
Oh, for sure. And I promise you, by the end of this deep dive, you are going to thoroughly understand the biological timeline of cellular regeneration. We are going to free you from that overnight fix mentality and hopefully equip you to navigate a medical landscape that is currently acting a little bit like the Wild West.
Yeah, it really is. And I think to understand the longevity of these intimate results, we have to first establish the biological reality of what an exosome actually is. Because the skin-deep hype totally obscures the mechanics.
So let's lay that foundation. What are we actually talking about when we say exosome? Because, I mean, you hear stem cells thrown around interchangeably, which I know is a massive misconception.
Right, they are not the same thing. At their core, exosomes are tiny extracellular vesicles. Just to give you a sense of scale, they're between 30 and 150 nanometers in diameter.
Wait, nanometers?
Nanometers. So that makes them roughly 300 times smaller than a single pore on your skin. Yeah, they are essentially just nanoscale lipid bubbles. And the crucial distinction here is that exosomes do not contain DNA. They are not live stem cells.
So they are basically like ghosts in the cellular machine.
That's a fun way to put it, yeah. They are biological messengers. They are packed with a highly specific payload like proteins, lipids, and most importantly, messenger RNA or mRNA.
Right.
So they travel from a donor cell to a target cell, fuse with that target cell's outer membrane, and then they drop that payload directly into the cell's cytoplasm. They deliver a specific set of instructions telling that receiving cell to reduce inflammation, initiate repair, and, ramp up collagen production.
Let me try to visualize this, because a common analogy I see is that they're like project managers handing out blueprints.
Yeah.
But based on how you're describing that mRNA payload fusing with the cell, it sounds, I don't know, a bit more aggressive than that.
How do you mean?
Well, it's more like taking a USB drive, plugging it directly into a factory's main computer, and just completely rewriting the manufacturing software so the machines start producing totally different materials.
Oh, that captures the mechanism beautifully, because the mRNA literally utilizes the target cell's own ribosomes, which are the cell's 3D printers, essentially, to translate those instructions into new physical proteins.
That is wild.
And what's fascinating here is that because exosomes work at this fundamental intracellular level to reprogram cell behavior, the physical changes are entirely beholden to the laws of biology.
Right.
A software update takes time to compile, right? And biological manufacturing takes time to build tissue. It simply cannot be an overnight process.
So what does that biological manufacturing timeline actually look like? Like, if I am a patient, when do I actually see the new tissue?
Well, the baseline data from our dermatological sources gives us a solid framework. Real benefits require aligning with the body's natural cell turnover cycles. For healthy tissue, that regeneration cycle takes about 28 to 40 days.
Okay, so about a month.
Yeah. In the first 1 to 2 weeks post-treatment, you might experience improvements in tissue hydration, mainly because of the localized anti-inflammatory response.
So that's the quick fix people think they're seeing.
Exactly. But the structural changes, the actual synthesis of new collagen and elastin networks, those require 4 to 8 weeks to mature.
Got it. So you are waiting at least a month, maybe two, to really see the foundation firm up.
Precisely. The cumulative benefits generally solidify at the 8-week mark and beyond.
Hmm.
And as for the longevity of those results, the data indicates that once the tissue is successfully repaired, the biological benefits typically last anywhere from 6 to 12 months.
And then what?
At that point, maintenance signaling is usually required.
Okay, so our baseline timeline is basically 4 to 8 weeks to build it and then 6 to 12 months of enjoying it. Knowing that structural changes require weeks to months, I want to see how this extended timeline plays out in highly specialized intimate applications.
Let's do it.
Because we're seeing how exosomes rebuild tissue, but let's look at what happens when they have to rebuild vascular plumbing. Which brings us to male intimate health, specifically treatments for erectile dysfunction.
Right. Erectile dysfunction, or ED, is incredibly prevalent, and the standard of care for decades has been entirely focused on symptom management rather than disease modification.
The famous little blue pill,
Mm-hmm.
Viagra Cialis. I mean, you pop a pill, you block an enzyme, and you get an immediate temporary effect.
Exactly.
But our sources detail this therapy called ExoFemale, which targets moderate to severe ED using a totally different philosophy, right?
Completely different. Medications like Viagra, which are PDE5 inhibitors, they function by temporarily relaxing smooth muscle to dilate existing blood vessels and increase flow. They do absolutely nothing to repair the underlying degradation of those vessels.
They just force the broken pipes open.
Yeah. ExoMol and similar exosome protocols target the root pathophysiology of ED, which is vascular insufficiency and peripheral nerve damage. These are the downstream effects of things like cardiovascular disease, diabetes, or just inevitable age-related decline.
So to target that root cause, the delivery method in the clinical data is, honestly, it's pretty intense. We are talking about intracavernosal injection.
Yes, we are.
For the listener, that means injecting the exosome serum directly into the corpus cavernosum, the spongy tissue of the penis. I mean, that is a massive psychological hurdle for a patient.
It is, but the anatomy demands it. To rewrite the software of those specific endothelial cells, the exosomes must be delivered directly into the localized tissue matrix. The protocol is sometimes structured as a concentrated course, often 1 injection a week for 6 weeks.
Oh, wow.
Yeah. And once introduced, the exosomes release vascular endothelial growth factors, or VEGF, which triggers a biological process called angiogenesis.
Angiogenesis, that's the literal creation of brand new blood vessels from pre-existing ones, right?
Exactly. The signaling forces the endothelial cells to proliferate and migrate, actually sprouting new microvessels throughout the penile tissue. And concurrently, the neurotrophic factors in the exosome payload promote the repair of the myelin sheaths around the local nerve endings.
Growing an entirely new vascular network is serious biological labor, and our sources state that full functional benefits for this typically take 3 to 6 months to develop.
That's right.
I have to push back here, though, because let's talk about the psychological toll on the patient. You are asking someone struggling with ED to drop thousands of dollars, endure a needle to a highly sensitive area, not just once, but maybe 6 times, and then wait up to half a year to see if it even worked.
It's a lot.
Compared to the immediate guaranteed effect of a daily pill, that is a massive leap of faith. How do clinics justify that timeline?
It is a significant paradigm shift for sure, and the psychological component is very real. But the justification lies in the clinical trajectory of the patient.
Meaning what?
Over time, for a vast majority of men, particularly those managing diabetes or recovering from prostate surgery, the oral medications eventually stop working.
Because the tissue is just too degraded.
Exactly.
Yeah.
The pills require a baseline level of healthy endothelium to function. If the tissue has degraded to the point where the roads are completely destroyed, the pill has nothing to dilate.
Right, so the pill is just traffic control. But if the bridge is out, no cars are getting across, regardless of the signals.
That's a great way to look at it. Exosomes are rebuilding the bridge. Because you are restoring the structural integrity of the vascular bed and the nerve function, the results are sustained. The therapy offers a return to natural, spontaneous function without pharmaceutical intervention.
That makes a lot of sense.
For a patient staring down the barrel of total pharmacological failure, enduring a 3 to 6 month regenerative window for a result that lasts a year or more is often the only viable path forward.
It is the difference between renting a highly temporary solution for the night and actually renovating the house so you can live in it.
Exactly. The regeneration fundamentally changes the long-term prognosis of the tissue.
So we've seen how rebuilding the vascular plumbing is a bit of a waiting game. But what happens when the problem isn't just blood flow, but the actual walls of the house collapsing? That
Yes.
brings us to the severe structural thinning women experience, particularly during menopause or postpartum. Can exosomes rebuild the literal scaffolding of vaginal tissue? And how long does that hold up?
The applications for female intimate health, frequently categorized in clinics as ExoFemale, demonstrate extraordinary potential for conditions defined by structural degradation. We are looking at menopausal vaginal atrophy, severe dryness, and complex autoimmune inflammatory conditions like lichen sclerosus.
Now, vaginal atrophy is primarily driven by the systemic drop in estrogen, right?
Mm.
Which means the tissue just stops regenerating the way it used to. And the data on the overectomized rat model in our sources is just wild. We are simulating full menopausal estrogen collapse here.
Right, the overrectomized model is the gold standard for studying tissue atrophy in the absence of ovarian hormones. In this specific study, researchers utilized exosomes derived from human umbilical cord stem cells. But rather than a simple liquid injection, they encapsulated the exosomes in a hyaluronic acid hydrogel, which was then applied to the atrophied vaginal epithelium of the rats.
I want to dig into that methodology for a second. Why the hydrogel? Why not just inject a saline suspension of exosomes like they do in the male treatments?
Because the vaginal canal is a highly dynamic mucosal environment, if you apply a standard liquid, the exosomes will simply wash away or diffuse way too rapidly before they can fuse with the target cells.
Oh, okay.
Hyaluronic acid forms a viscous, porous, three-dimensional matrix. It physically traps the exosomes, creating a sustained release delivery system. As the hydrogel slowly breaks down, it constantly feeds the exosomes into the underlying tissue, ensuring prolonged receptor engagement.
That makes perfect sense. And the biological markers they tracked to prove this worked are fascinating. They looked at Chi67 and CD31. Let's break those down because they tell the story of the timeline. Chi67 is a nuclear protein, right?
Right. It is a protein strictly associated with cellular proliferation. Chi67 is entirely absent in resting cells, but it is heavily expressed during all active phases of the cell cycle. When researchers see a massive spike in Chi67, it acts as a molecular odometer, proving that the tissue is actively and aggressively dividing and growing.
And CD31 is an endothelial marker, so that is showing the borders of new blood vessels forming in the tissue. So they are seeing literal structural growth and new blood flow. But here's where it gets really interesting. The highest rate of cell proliferation in that study happened without any estrogen involved whatsoever.
None.
The exosomes were driving the tissue regeneration entirely independently of hormonal signaling.
If we connect this to the bigger picture of women's health, that isolated detail is revolutionary. Currently, the frontline defense against vaginal atrophy is localized estrogen therapy. However, long-term estrogen utilization carries fiercely debated risks for specific demographics.
Most notably, survivors of estrogen receptor-positive breast cancer or endometrial cancer. I mean, if you are a breast cancer survivor, your oncologist is likely drawing a hard line against any estrogen therapies, which leaves a massive population of women dealing with severe intimate discomfort and virtually no options for biological relief.
The research suggests that exosome therapy can bridge that exact gap. It provides a sustained, non-hormonal regenerative pathway. We can prompt the tissue to synthesize collagen, increase its epithelial thickness, and rebuild its vascular networks without systemic or local hormone exposure.
That is massive.
Yeah.
So how does this translate from the lab to human timelines in the clinic? Because women aren't usually getting hydrogel applications, right? They're often stacking these treatments with high-tech devices.
True. In modern clinical practice, exosome serums are frequently layered with energy-based modalities. The most common are fractional CO2 lasers or radiofrequency microneedling devices, like Morpheus 8V.
The device is essentially doing the mechanical labor of opening up the tissue.
Exactly. The laser or the microneedles create thousands of controlled microinjuries in the mucosa. This triggers the body's acute wound healing cascade. When you immediately apply a topical exosome serum into those freshly created microchannels, the exosomes bypass the surface barriers and dive deep into the tissue layer.
So the energy device initiates the repair, and the exosomes supercharge the cellular response.
Bingo.
What kind of longevity are the sources showing for these stacked treatments?
Well, energy-based treatments on their own demonstrate statistically significant improvements in vaginal elasticity and mucosal health that hold for 12 to 18 months. By integrating the exosome signaling, clinics are aiming to optimize the quality of that newly synthesized tissue and accelerate the initial healing phase.
And the protocol generally looks like an initial loading phase of 3 sessions spaced a few weeks apart, and then maintenance sessions every 6 to 12 months to keep the tissue vital.
Yeah, that perfectly aligns with the biological half-life of the new collagen networks we discussed earlier.
Okay, so we've established that this science is incredible. It offers long-lasting root cause healing, vascular regeneration, and non-hormonal structural repair. The obvious question any listener has right now is, why isn't everyone just marching into their local med spa, getting a quick session, and enjoying their newly regenerated tissue for the next year?
Right.
We need to look at the reality check here because the sources are waving some massive red flags.
The reality check is critical. It involves the inherent unpredictability of biological variability, but more pressingly, it involves a minefield of legal regulations and clinical ethics that consumers are largely blind to.
Let's start with the biology. Our sources emphasize heavily that this timeline is not a blanket guarantee.
No, not at all. Exosomes are highly advanced signaling therapies, but they are not magic. Your individual biology still has to manufacture the proteins. The results will vary wildly depending on the patient's chronological age, metabolic health, autoimmune status, and lifestyle factors. You are investing in a 3 to 6 session protocol, and the outcome is heavily dependent on how robustly your own cells respond to the software update.
And then there's the legal side, which is where the Wild West analogy comes in. The regulatory warnings in our stack are severe.
Very severe. The market is completely saturated and deeply unregulated at the clinic level. In the UK, the MHRA, the Medicines and Healthcare Products Regulatory Agency, has drawn a very clear line. They classify injected exosomes as medicinal products. Furthermore, any cosmetic products derived from human tissue are explicitly banned in Great Britain.
Let me make sure I'm understanding this. If the MHRA classifies them as medicinal and bans cosmetic human tissue derivatives, and a UK aesthetic clinic is injecting human umbilical cord exosomes for anti-aging, wait, they are operating outside the law.
If they are marketing and administering it as an unregulated cosmetic treatment, yes, they are violating those guidelines. Legal utilization in the UK aesthetic sector is essentially restricted to topical application, meaning it is only applied to the surface of the skin or mucosa after a procedure like microneedling. It is not legally approved to be drawn up in a syringe and injected deep into the tissue for cosmetic purposes.
And I imagine the U.S. regulations are just as strict, if not more so.
Oh, absolutely. The FDA classifies exosome products intended for clinical use as drugs and biological products, which strictly require pre-market approval. Currently, there are 0 FDA-approved exosome products on the market for these types of regenerative aesthetic or intimate treatments.
0.
0.
Which means every single med spa or clinic advertising FDA-approved exosome injections on their website is fundamentally misleading or outright lying to their patients.
It is a profound breach of clinical integrity. Independent laboratory analyses have actually revealed that up to 95% of commercially marketed exosome products do not even meet the structural or functional definition of an exosome.
95%.
Yeah. Clinics frequently hide behind ambiguous marketing terminology like regenerative serum, growth factor blend, or stem cell derivatives.
So for the listener who is navigating this right now, what is the actionable safety checklist? How do you avoid getting scammed with expensive salt water?
You have to demand radical transparency. Request the exact product name, the manufacturer, and the sourcing laboratory in writing. But beyond the product itself, you must ensure you are receiving a comprehensive medical assessment.
This is huge for intimate health because the symptoms can be incredibly deceptive.
This raises an important question about diagnostics. You cannot assume a biological regenerative product is the solution without isolating the actual cause of the dysfunction. Is your intimate pain driven by a hormonal deficit? Is the erectile dysfunction psychosexual in origin? Or, very commonly, is the issue related to hypertonic, spasming pelvic floor muscles?
Right.
If your pelvic floor is entirely locked up in spasm, injecting exosomes into the tissue will not resolve the mechanical tension. Proper medical assessment must precede regenerative intervention.
You don't want to spend $5,000 trying to rewrite the software of the house if the real problem is that the foundation is sitting on a fault line. Assessment matters infinitely more than the hype.
Exactly. Diagnostic clarity is the only way to ensure the therapy actually matches the pathology.
Well, let's bring all of this together for everyone listening. We set out to answer exactly how long intimate exosome results actually last, and we've discovered that the answer is dictated by the inescapable laws of biological manufacturing.
Biology always wins out.
Always. This is not the overnight face filter fix that social media promises, because exosomes work by instructing your cellular machinery to physically synthesize new blood vessels, repair nerve myelin, and weave new collagen networks. The full functional effects demand patience. You're looking at a 3 to 6 month runway for the tissue to reach its absolute peak.
But the reward for enduring that timeline is profound longevity. Once those new vascular networks are established and the structural scaffolding is reinforced, the regenerative benefits can sustain for 6 to 18 months. They offer a deeply restorative and, crucial for many, non-hormonal alternative to masking symptoms with daily medications.
It is entirely about rebuilding the underlying architecture, rather than just painting over the cracks in the drywall. But before we wrap up this deep dive, I want to leave you with a philosophical concept to ponder based on everything we've explored today. Think about what this mechanism of action really means for the future of human medicine.
It's massive. It forces us to reconsider the human body not as a decaying machine, but as a responsive system.
Right. If we can successfully isolate, bottle, and deliver the exact mRNA instructions for tissue repair without even relying on live stem cells, are we entering a medical era where our own bodies become an endlessly updatable pharmacy?
It's a staggering thought.
Think about the implications. If we can continuously plug in a flash drive that prompts our localized cells to act young again, to sprout new blood vessels on demand, what does that mean for how we define the biological limits of aging?
It completely challenges the assumption that tissue degradation is an irreversible one-way street.
Suddenly, looking at an aging joint or a failing vascular network isn't just about managing the decline. It's about looking at that tissue and asking, what specific software patch does this need to heal itself? Machinery is already there. We just finally figured out how to write the code. Thank you for taking this deep dive with us today. Keep asking the hard questions, keep looking past the filters, and we'll catch you next time.